But we're going to talk now to Louise, who was the occupational therapy student allocated to the Nexus PCN. If you'd like to introduce yourself, Louise.
Hi, so I'm Louise, and I'm in my final year of the 2-year MSc Occupational Therapy pre-registration course at the University of Plymouth. So I'm on my third placement here at the Nexus PCN in Exeter.
Fantastic. And how did you initially feel when you were told you were allocated a placement in primary care?
Yes, I was actually really excited about it, as I knew that this was sort of a newer setting for OTs that they could sort of be based in. I felt that having experience in primary care, along with the secondary care placement experience that I also have had, would give me sort of a really well-rounded knowledge of what care is out there for people, and obviously for patients and service users. I was slightly apprehensive about working in a newly set up service, as I wasn't sure about what demands my educator would be under, and whether it'd be a bit confusing as a student to come into like a new service and things.
Yeah.
But actually, in reality, it's been really interesting to be present for some conversations that have happened firsthand, especially around like service development. And it's also created like a really reflective and proactive environment to be in, which I've really enjoyed. And I've had a really good opportunity here, thanks to my educators, to carry like a really manageable caseload with all the support that I've needed, especially as it's my final placement. And that's been great. And then because it's a new service and they've been receiving sort of new referrals in, it's actually felt great to be really useful to them. When picking up a caseload, which I would be expected to do, it's actually been really good to be another sort of helpful pair of hands. It's really nice as a student to feel that you're being useful and not a hindrance or anything like that. So that's been really cool. Yeah.
Absolutely. Have there been, besides kind of everything you've said, have there been any particular highlights of your placement so far?
Yeah, so I've really enjoyed learning about primary care, because it's not a care system I was really aware of at all. So I've just really enjoyed sort of stepping into this world, really, and it is very different from secondary care. And it's been really nice doing that sort of more preventative work as an OT. So getting to service users, not all the time, but getting to them before they're in crisis or they've had a hospital admission, and that feels like really valuable. So that's been really nice to be a part of. And it's actually been a really straightforward OT process here. It is very similar, so it's nicely transferable from other placements, because they're seeing patients quite quickly and not necessarily for a long period of time.
Yes.
So for a student, that's really good, because you're going through an OT process quite regularly, which has meant that I've had lots of cases and I've completed lots of OT processes with people. So as a student, that's been really beneficial, when I know in previous placements I haven't seen the outcome for the patients, but in this setting I have done, so that's been really good. And then, as I said to you, sort of carrying my own caseload has been really great, because it's really helped me pull everything together from my other placements, and pull together all these sort of knowledge and skills. But again, it's in a really, I think, a good environment to do that as a student, because the processes are quite short. So yeah, it's been really good to sort of cement my knowledge and skills. So that's been, really good.
So do you have any advice for other students who may be allocated a primary care placement in the future?
Yeah, I think trying to gain some knowledge about primary care and primary care networks. I did a little bit of research beforehand, and that was really useful. To do some training on the EFHL, which the University of Plymouth students are all set up on anyway.
Yeah.
About primary care, and it's some of the first modules on the first contact practitioner pathway, but you can do those for free. You just need to request access to them, and that was really beneficial. So there was what is primary care? I did one on I've got it written down here, identifying ill people and people at risk, so sort of some warning signs, which has been really useful. And a mental health, sort of very introduction to mental health, because although they're not mental health OTs, because it's a GP practice, you are seeing varied amount of people. So that was really useful, just to have some sort of basic knowledge. it was really useful as well to understand the role of the GP, because then you better understand how the OTs in primary care are supporting them, which is a big part of the role here, is to support GPs. And I actually I was really lucky to have the opportunity to shadow a GP for one of their clinics. I know that's not always possible, but that was one of the most beneficial things to sort of understand the GP role. Yeah. And then it's useful in any placement, I think, that spending time shadowing the other professionals within the primary care network to gain an understanding of where the OT sits within those teams and that MGT working. And then also, whilst I've been here, my educators have been great at setting me up with the other OT services in the area. Okay. And it really helps to sort of understand where the primary care OT sit within the other, like amongst the other OT services. So yeah, that was really useful.
You've got a really good overview of the kind of the whole system really and how it all works.
Yeah, because then you can understand the benefit of where primary care OT sit and how that can support other services and where it all fits in, because it's like obviously it's a bit brand new, and I had no knowledge of OTs in primary care before this placement, so that's really helped me understand where everybody sits and what everybody does and how they're all working in conjunction with one another. That's been really useful.
Fantastic. And is there anything that hasn't gone so well, or that you would have preferred to have been done differently with the placement?
No, not really. I've really enjoyed it. I didn't get access to the NHS email, which I had for a previous placement, but I didn't gain access for it here. And I think that was just made work a little bit less productive, because I couldn't get onto the teams that the team here use. So I couldn't see all their resources and the processes that they do. So it's always added another step, because I've had to email it to them or ask them to do things for me that I've just been using my university email, and then obviously not putting confidential information in emails. But yeah, that was the only thing really. It would have just made it a lot easier to work as they do and learn the processes as they do them. But no, other than that, I haven't mentioned actually that I've done the home service here, and they've also got the care home service.
Okay.
There's another OT here that looks after the care homes, and then Gemma and Becky, who's just spoken to, do the home service, and that's been really good to delve into both sides of the primary care OT work. They're doing work in care homes and then also seeing the home service. So that's another good thing that I forgot to say. Yeah.
Lovely.
Yeah.
So how will this experience impact or influence your future practice, do you think?
I think it's taught me about sort of taking a really preventative approach and really focusing on that preventative work, which is really beneficial for being proactive in people's care and looking at like reducing hospital admissions or the strain on other services. So I can really, it's really taught me the benefit of OTs in primary care. And I think, just that preventative focus I'll try and keep in mind. And also I've seen a real benefit of signposting service users to information and different services and support available. So that, again, that stroke-based approach, it's been really good here, giving people informed information so they can make decisions earlier on. That's been really, I've seen the benefit of that. So it's something definitely I'll keep in mind again for the future. I just think I'm really lucky that I now know what primary care OTs, the services, what the service involves and what they do. So that I feel that's really going to benefit me in the future, because it's another service that I now know about, and I can, again, I've learned where everyone, I've begun to learn where everyone sort of fits in, everyone does. So I feel like I'm really lucky in that I have experience of primary care and secondary care now. So,
yeah, and I suppose sort of having a better awareness of that whole patient journey and who they might be looked after in which setting, and it's given you a really good overview by the sounds of things.
Yeah, definitely. I think it's beneficial for if primary care OTs is expanding and it's growing and it is more present everywhere. So I do think it will be important for students to learn about primary care OT as well as secondary care OT. Yeah, if it continues to expand the way that it is.
Yeah, that's what we're hoping.